In this Walker Street Doctors update for Tuesday the 18th of January 2022, I'll just take this opportunity just to tell it like it is at the grassroots at the moment. With regards to the severity of COVID, if you've had COVID and it's been a mild illness for you, you can be very grateful because it certainly isn't like that for everyone. Some of our patients are requiring intensive treatment in hospital and some are off work for weeks on end with ongoing symptoms. My advice is not to be fatalistic that everyone will get this at some stage. We know what to do to protect ourselves against respiratory viruses, to ventilate indoor areas, to stay a metre and a half away from others where possible, to wear a surgical or N95 mask and to wear it correctly at all times while indoors with the nose covered, to sanitise hands like you've got OCD and to clean high-touch areas similarly. Beyond prevention, vaccination is obviously the best thing to do to turn a major disease into a minor one, and most of our patients have got the memo on that one. However, particularly if you're over 50 and have had an AZ primary course, please do make sure that you've got an appointment before the end of January for a Pfizer or Moderna booster. We're not getting thingy about the 3-month, 4-month, 5-month thing. We just want you to be protected. And if you can't find an appointment with us online, please don't be discouraged. Just give us a call and we'll book you in somewhere. Our advice is also to get yourself COVID ready. That is, to get yourself in the best possible health, just in case COVID comes your way. Have any underlying conditions under control, in particular for asthmatics who take their medications infrequently. My advice at present would be to make sure that you're taking something regularly. A tight chest and increased asthma symptoms has been a real theme in the last few weeks. If you're a diabetic or have chronic iron deficiency or depression or any other underlying condition, it's best to get those conditions as under control as possible. Have sufficient regular medication on hand in case you need to be isolated for a period of time. Eat well with 5 serves of vegetables and 2 serves of fruit each and every single day. Ditch the junk food. Reduce alcohol intake if this is an issue for you. Find a way to reduce workplace stress. Stress is absolutely toxic to your health. Learn how to meditate in order to dissipate adrenaline. Find a way to get 7 to 8 hours of good quality sleep every night. And make sure that you're getting some sunshine or are taking vitamin D supplements. Exercise moderately, at least 30 minutes every day. And don't overtrain, especially in the first few days after vaccination or if you find yourself feeling unwell. Take some extra vitamin C if you start to get symptoms and find something to be grateful about every day. These aren't just motherhood statements. They're the foundation of long-lasting, excellent health and will give you a leg up if COVID does come your way. They might also just help protect you against long COVID, which can occur up to 6 months after even mild COVID illness. It's not just about fatigue, but also depression, anxiety, chronic headaches, neurological symptoms, pain, and even an increased risk of new onset of diabetes can be part of this condition that we'd all really rather avoid. If you're coming into our surgery for a vaccination and you develop any symptoms, which could even possibly be the start of COVID, particularly a runny nose or a headache, please respect that we have extremely vulnerable patients coming into our surgery for vaccination at the present. And please defer your vaccination out of respect for them. With regards to vaccinations for our children aged 5 to 11 years, we're all hearing through public health forums that there are plenty of vaccines available to have this age group vaccinated prior to school starting. Although Walker Street Doctors has the capacity to do many times more than the 50 doses per week that we and other general practices have been allocated, and that many parents would prefer to bring a child to a GP rather than an immunisation hub, we're all very much constrained by stock shortage. And as a result, we've had to cancel around 100 appointments for this week. FYI, the Pfizer paediatric vaccine comes in multi-dose vials with 10 doses per vial. And if we're really careful in the drawing up process, we can often get 11 doses out of the vial. When we had 1 or 2 extra doses in the day last week as a result either of a cancellation or getting an extra dose out of the vial, we did call everyone on our list for this week and for the coming weeks to bring their appointment forward at short notice, giving them an opportunity to get in earlier and to make sure that no precious dose was wasted. Most people actually turned us down and were then appropriately upset and angry that due to circumstances out of our control, we had to subsequently cancel or defer their appointment. I can promise you that at Walker Street Doctors, we are doing everything within our power to have your child vaccinated prior to the start of school. But the reality bears little resemblance to the public spin that we're hearing. With regards to rapid antigen testing, we're being told that there are rapid antigen kits flooding into the country. But on the ground, we've been waiting more than a week and a half, for a box of rapid tests from our medical supplies company. We've had to severely ration rat tests in exactly the same way that you have. My own local pharmacist has had an order for rapid antigen tests on back order for 5 weeks. We're hearing today that in a few short weeks, students will have to do twice weekly rat testing before attending school. Again, the reality bears very little resemblance to the spin. And on that cheery note, stay well, fit and healthy, and I hope this update has been helpful.